Hi, I'm Mike Gregory. This is all about the Deo Dental product line, product range. I've got Dr. Sam Labib and Bryn Thompson here, who've been co-developing this with us. They've been heroes, they beta tested the stuff. And it's all come from Jai Ragbir from Deo Dental. So we've got this going since the end of 2023, and we're going to talk about the product. So it all started with the Deo Dental water bath. This is what everybody wanted, and this is what we came up with in a fairly short space of time. And then it really got rolling, and we produced some other stuff. The great thing about it, it's been developed in the UK. So these guys are UK, I'm UK. Nobody's been paid saying this, by the way, guys. We're not on the payroll. We just love the unit. It's manufactured in the UK. It's been designed in the UK, trialled in the UK. A 2-year warranty. So the only thing we would say about this, guys, is, and there's always a temptation, that the inside of the water chamber doesn't look dissimilar to that. You cannot put water in here. You cannot put water in there, otherwise you're going to blow the unit up. You have to use the proper water chamber that takes the basket. So this is not meant to take water. This is dry heat. It says source is dry heat. You put whatever component you want inside it. So if you're going to put impression compound, you need the separate water bath that goes in it with a separate basket, and that drops in the unit. So that's the thing you've got to be careful of. Otherwise, a lovely unit. This is how we heat impression compound. And then we got clever and we thought, why don't we actually use something to melt wax? So this is for adjusting occlusal rims. This is great. You can actually melt wax on there and catch it in there. And Sam has got a nurse who just thinks this is magic.
Practically, this is brilliant, because rather than creating a mess in your surgery, which your nurse will curse you for, all the wax comes and gets collected in this silicone cup, which can easily be peeled away, removed, and then you get rid of the wax and sterilize it, and everything's good to go again. This was a absolute stroke of genius.
And Bryn would probably like to say something about this, because Bryn's nurse, Sheila, who's quite famous for all sorts of things, doesn't like mess. So yeah, tell us about lack of mess, Bryn.
Well, apparently it's great. There's no wax all over the bench, coming off my paint stripper, wax knife and everything, and the plate here it's just an absolute joy when you have the wax rim melting on this. It just sort of floats off absolutely superbly. So this is almost just as good as the original product, which is fantastic. So yeah, this is one of my favourite bits.
Yeah, Bryn was almost lost for words when he saw this. He said the wax rim just floats on there.
Speechless.
Yeah, speechless. So just a magic product. And then it got even better. I said to Jai, what can we do next? Well, we use mirrors, and we need to heat them up. And if you heat them up in hot water, it's a pain. So basically, I think Sam's a big mirror man here. He takes a lot of photographs.
I do take a few intraoral photos, and not being able to have fogging of the mirror is amazing, as we all know. Rather than using a 3-in-1 to blow air onto the mirror, or having to put it in hot water and then dry it out, you've got a dry air chamber and a perfect setup for your slim intraoral mirrors and your wider ones. The photographs come out absolutely crisp. It is a perfect way as another use for the product.
And of course, the great thing about the product is it's just one common unit. So the bottom line is you take one component out, you drop another one in, press the appropriate program, and it produces the right sort of heat for the task in hand. So we do mirrors, we melt wax, we can melt compound, and again, whatever task we set Jai at Deo Dental comes up another one. So we thought, well, green stick, we love green stick. We guys all love green stick. Yeah. I think we'll agree.
Yeah.
So we thought, well, what are we going to do here? So we've got a green stick heater now. So we put syringes of green stick in, drop a stick in a syringe, single unit syringe, sterile one produced, put it in there, heats up, inject it onto the tray. No flames. Again, no mess. I think you'll agree. No mess to clear up.
No mess. And certain practices will have a flame-free policy, that kind of thing. This is absolutely perfect at getting around that problem, and just makes life really easy.
And any dentist who's used one of those green sticks knows what it's like to have it overheated, fall on the glove, cause a lot of pain.
About that. That hurts.
So that really does.
Really does.
So having this, where you're able to inject it directly where you want it and with the amount that you need, ideal.
It's perfect. And I think with all the modules, the key thing is it's a uniform heat, which when you're trying to heat various things up, the problem can be sometimes just keeping that uniform heat. Like with a compound heater, you know, I've in the past just sort of boiled some water up and tried to do that. It's just a
Don't do
mess.
that, right?
So this way is perfect. Just keeps a uniform heat when you need it, for as long as you need it, on all the modules.
And the last thing that came along was the last task we set Jai. He can do anything. He's proved that. He can just churn anything out. So some guys like to heat their composite. So we've got this unit here. You can put your compule guns in. You can put syringes in. And Sam loves composite. Tell us about the bit that's hiding under the cover there, Sam.
So before the patient comes in the chair, you can prepare the unit with practically whatever you're going to be using when you're doing composite. If you're a syringe person, you can be using those. If you're a compule person, you can be using those. You can have your gun ready to go, and everything is sterilizable and autoclavable.
And your endodontics?
If you wanted as well, because you can regulate the temperature and set it to whatever you want it to be, if you are doing root canal treatments and endodontics and you want to warm up your hydroxide or your EDTA, again, you can set the temperature on this unit and load your syringes in here, and you can have them at the temperature you wish.
Bryn's now going to tell us why the wax heat is so clever.
So on this module here, we've got these wax heater inserts. So you take one of those out that's preheated, and the plastic holds the heat, and then you take your pre-cut sheet of wax that you're going to use to modify your tray with, and then you just close it on that, give it a squeeze, and then you just leave it for, well, it's not even
10 or 15, so chuck it back on the worktop, 10 or 15 seconds. You don't put it back in the unit, you don't need to put it back in the unit, you literally stick it on the worktop and the heat gets sucked out of the unit, heats the wax up, and the wax is soft and pliable within 10 seconds. And you can do that twice before it cools down too much.
It's just a perfect uniform heat. It's so much nicer than putting it through the flame. It's just exactly what you need, exactly when you need it. So yeah, this is pretty exciting.
Absolutely mind-boggling piece of engineering, this. I think all three of us were giggling when we saw it for the first time.
Really? Seriously, you can do that?
Absolutely mad.
So clever.
Yeah.
And the last thing, which was the thing I set Jai, the task at the beginning, the whole thing needs to be cross-infection compliant. So every single unit we use, medical grade polycarbonate, and whatever goes in there can come out of there, go through a washer disinfector and then through an autoclave. So the clean down's easy, the cross-infection compliance is there 100%, and the outside of the unit you just wipe down with sterile wipes, disinfectant wipes. So just a great addition to any surgery. And the footprint's tiny as well. I think you said that, didn't you?
Yeah.
They take up no space on the worktop.
Absolutely. Really critical when you've got a smaller surgery. You've got one small unit with a small footprint that can cover a multitude of jobs. So you can keep your bench space as clear as you need it to be.
Good point.
The modules, I was going to say, stack away nicely in the cupboards as well. So it's really good on space.
And as Sam pointed out at lunchtime today, the power supply, this is great because it's basically a kettle lead. So where we are in the world, it's a single plug that goes in the back, and it's whatever your mains voltage is. You haven't got to worry about the fact that it's going to have to run off a 110 transformer or something like that. No USB-C, USB, nothing like that. Just a robust plug that goes in the back of the unit, and that's not going to come unplugged by accident. You're not going to lose your power, and everything's just going to function beautifully.
And from a principal's point of view, whether you're an associate trying to convince your principal to invest, or if you're a principal yourself and you are sort of looking after the pennies, the value for money for this is amazing when you think at how much you can get from one product. Having a product that is so diverse and can do so many different things is invaluable in dentistry. And
all you got to do is go onto the website, and it's a direct order, ship anywhere in the world for the same price. So just log onto the website and just order.
It's the ultimate dental multi-unit.
So here we have Deo Dental. This unit has been developed over the last 14 months in association with Deo. I've been running impression taking courses for a few years now, and everybody's after the same material, equipment that I've got, a water bath. The equipment I've got is a water bath from the 1980s, which is a real issue because you can't buy them anymore. So for a long time I was looking for something that could go to the market and actually work for clinicians in this day and age. I found, after a good few months of looking, a company Jai Ragbir from Deo. I emailed him at the back end of 2022. I wasn't convinced they're going to come up with a product we were after, but ultimately it's worked a treat. So back end of 2022, we started talking, and the beginning of 23, we had an initial product, and now we've got this amazing unit, which will actually not just heat impression compound, and you can manage green stick with it, but you can also do a range of other procedures you do clinically. So this is the beginning of the changing of the way you do clinical dentistry. It's just going to make life so much easier for so many people, not just in removable prosthetics, but in restorative dentistry as well. I think this is going to be a big hit and really popular with a lot of people because it's one unit and it'll do everything. So what we're going to do now is primary impression using a stock tray, check it fits the patient's mouth. So friendly patient will pop his head back, just try this in and make sure we've got an appropriate fit. It's only going to be a rough fit, which is why I use an impression compound. So the tray goes in, what we've got to do now is modify this to make sure it fits. So we're going to put impression compound in here and go back to the patient. Now is stock tray, preheated compound. In this respect, we've got 4 sticks of ChemCat preheated. As I say, I can't emphasize enough, you have to wrap this stuff in gauze, otherwise it's going to make a complete mess of the water basket. So you take the compound out, back in the water, beautifully pliable. You put the compound in the tray, and then you head back to the patient and get the initial first seating. So we're going to go back to the patient there. So dip this back in the water for a few seconds, grab your mirror and go to your patient. Compound's roughly shaped up. Because it's warm, it'll just flow. Retract the cheek, slide the tray in the mouth, and just insert and push up. Just tell the patient it's going to be slightly warm. Finger in the middle of the palate, finger and thumb under the nose, and squeeze. And then you manipulate the cheeks. And importantly, get the patient to excurse the chin left to right. So if you push your chin left to right, then that'll actually squeeze the compound in the right place. Then after a couple of seconds, you take it out and you look and see what you've recorded. So we've taken this out in the mouth and we're going to be short around the sulcus. That's normal. That's not unusual at all. So basically we're going to use green stick now to increase the sulcal depth. So we've got preheated green stick. We're going to apply some green stick on this and go back to the patient. So now we've got preheated green stick in here. This is up to 125 degrees. It's not actually 125. So what we're going to do now is I want to increase the extension of here. So we're going to actually place green stick. And this just flows so nicely. I'm just going to record one side that was missing on the compound. So add some green stick, put the bung back on, back in the heater. This needs tempering, this is going to be too warm. So you put it back in the water bath, and that'll take it down to the same temperature the compound was. Then you go back to your patient, try it in. So now, tell the patient it's going to be a bit warm top left, slide it in, seat the tray back where it was, finger in the palate, and then you just pull the cheek round, squeeze thumb and forefinger, ask the patient to move their chin left to right, and that'll get the sulcal width in the buccal sulcus, buccal to the tuberosity. In for a couple of seconds, and then you just take it out, and the green stick will have formed the missing sulcus. So we've got full sulcal depth all the way along here now. All we're going to do now is the same process on the other side. So we've done one side, now we want to get full sulcal depth on this side. So same thing again, get some pre-melted green stick, inject onto the edge of the tray, then go back to the patient's mouth with it. So preheated syringe here. So same thing, take the nozzle off the end and literally just inject the green stick. And this is so much better than using a naked flame. And if you've got an establishment where naked flames are banned, this is not a problem. It's also not as hot as if you'd used a naked flame. So there we go. Now again, it's going to be too warm. Back in the water bath, just the side you're using. Back down to the right temperature, temper it, then take it back to the patient. So, green stick injected, back to the patient, tell them it's going to be warm where it's going to be warm. And slide in, same again, manipulate the cheek, squeeze under the nose, patient moves his chin left to right. A couple of seconds to cool down, then you take it out, and you've got the full sulcal depth on the other side. All you've got to do now is apply adhesive, take an alginate impression. So we've got a stock tray here. This is not going to fit in the mouth, we know that, so we're going to have to put impression compound in both the free end saddles, which is preheated. So judge the size of the saddle and use the right amount of ChemCat. Pick the compound out the basket. This heats in moments, and got a freehand saddle, so I think the bigger freehand saddle is on the. So place that in the tray, roughly where you want it. Any excess remove. Back in the water bath because it'll cool down when you touch it with your hands. Get it back up to temperature, and then when it's up to temperature, you go back to your patient. This is preheated now. Back to the patient, just tell them where it's warm, as always. And as always, fingers on the top, thumbs under the chin, and just squeeze down gently. And then pull the cheek round, push your finger lingually, push the green compound where you want it to go. Let it cool down for a couple of moments. Patient licks his top lip, left to right, and you take it out. And there's your freehand saddle. I have to say, sometimes they look good, sometimes they look beautiful. That's beautiful. So the green stick's now melted. Just take the plunger, put the plunger in the top. Sometimes a bit of air resistance doesn't matter. Take the plunger off the end, the cover off the end. Your previously modified tray with compound. If you want to get a bit more sulcal depth, in this case we actually don't need it. Just inject the green stick on the end, and then you're going to go back to the water bath with it to make sure it's tempered to the right temperature of the patient. Back in there, and in a minute I'm going to go to the patient with it and take the impression. So green stick's been applied, back to the patient's mouth. Tell them it's going to be warm inside bottom left. Seat the tray, finger on the top, thumbs under the chin, gently squeeze. And if you've got a strong tongue, you can just coax the green stick lingually with your finger. Ask the patient to lick their top lip, left to right. And a couple of moments, take out. Carefully, don't touch the lower teeth. Pull it out. And you see the green stick addition. So now we've got full sulcal depth. So we've done the freehand saddle, we've filled in the big tissue gap, we've also added some green stick to get full sulcal depth. The area around the front here, we need to add some wax. We need sheet wax to get full sulcal depth. So Jess will now get some wax ready now. We get 4 bits of wax out of a sheet. So we just snap it in half, cut it in 3, whatever, if you want a bit more wax. And what we're going to do now is actually melt the wax in the Deo warming cartridges, which are really clever. So now we're going to heat this up and get it pliable without a naked flame, so we haven't got to worry about making a mess and upsetting those who are excited by naked flames. So Jess has now got the right size piece of wax, about 1/3 of a sheet. If you've got really deep sulcus, you need 1/3 of a sheet, sometimes 1/4 of a sheet's enough. This is the clever bit. So these are preheated, and these retain the heat. These are really clever. It's not my invention, so I can't take the credit. So you get the piece of wax, you place it on here, and this polycarbonate wax retains the heat. And you just literally sandwich the wax, and the wax is starting to, you can see the wax is heating up now, it's changing its consistency. I want to add some wax to the tray to get full sulcal depth, and this is just so clever. So 10 seconds later, you open it up, and the wax has become pliable. That's just unreal. I cannot believe that we've engineered that. That's just genius. Jai and his team. So that's now soft pliable wax in 10 seconds. You get your stock tray. As ever, you start the wax where the compound stops, get the smooth edge, and roll the wax around the tray. And the consistency of this is just so good, and I never imagined we'd manage to get this far. So Jai's in the background here, chuffed a bit. So there, all you do is then go to your patient and place it in the mouth. So we've now got the wax added to the tray. This fits to one side. Put this in the mouth, and the wax will just, because it's still soft, will adapt just the way you want it to. So slide it in, push it into the sulcus, pull the cheek round. And this is the way you do it, guys. Seat the saddle, thumbs underneath the edge of the tray, against the chin, and just push it in. So this will now adapt to full sulcal depth anteriorly. It's literally in the mouth, 3 or 4 seconds, take it out. Carefully, make sure it doesn't catch the teeth. Great retention. Really good retention here. And then you just straighten up the edges. So now you've adapted the tray, wax in the sulcus where there are teeth, compound and green stick in the sulcus where there are no teeth. And that's how you modify a stock tray with wax using the Deo sheet wax heater. Deo Dental managed to turn around a water chamber for melting impression compound in a few weeks. So I thought, let's get ambitious. Let's just push Deo Dental. Let's push Jai. Can he make another product? And what everybody wants, another unit you can't buy, is a hot plate for melting wax rims. So you want to melt a wax rim, something like this, you're treating a patient, you need to get the registration rims trimmed properly. So let's make a hot plate that'll actually melt wax. So we've got a unit here which has got a hot plate with a hole in the middle. The wax will run through and is caught in a receptacle inside a silicone dish. So the whole lot again can go through the autoclave. This is autoclavable, the silicone dish is autoclavable. There's a neat little drip thing in the bottom to catch the wax. So the way you use this is, you preheat this to 125 degrees, you just press a button and it takes it up to the right temperature. And the way this works, I'll just turn this around to give you a demonstration. You need to make sure the wax runs to the back of the unit. So you can see, as I said, the hole at the back will catch the wax. And this is just amazing. 125 degrees, you've got a registration rim, you put your rim on your cast, I'll take it off for video purposes, and you just melt the wax. And you can change the contour, so you can change the height. You can also change the labial contour. So if you want to reduce the amount of lip support, you just take the wax around the front. That couldn't be easier. And the joy of this is, the wax is caught inside. When you've finished doing this, really important guys, you need to get a tissue and wipe over the top to wipe the excess wax off while it's still hot. Any excess wax that's running through, so it goes through the nozzle, is caught inside the unit. So Deo Dental came up with this amazing second unit, and there's nothing on the market as far as we know, so they've met the brief, make a hot plate that's autoclavable, easy to use, and this just fits on the standard Deo Dental base unit. The problem with rims is the uppers and lowers are different. The upper rim's easy, you put it on there and it doesn't matter, because the rim, the highest point of the rim is here, so there's nothing above it. On lowers, and this is where we had a design revision with Jai, I said the lower rims are different. We have heels that stick up on these, and these don't want to be flattened off. So basically, that's why we have a cutout at the back of the rim, so you can actually put the rim on the hot plate and not change the shape of the back of the heels of the wax block. So you can hang the rim off the back. Makes a big difference. This is why in-house developed UK made such a difference. Turned around in a couple of weeks. So when you finish trimming your rim, demo purposes, a bit of wax, you're going to have wax residue on the top of this plate. If you push this through a washer disinfectant autoclave, you're going to cause damage. So the important thing is run this at 125 degrees, as you would have been, get a tissue and wipe the excess wax off. If you do this, it's not going to affect any equipment. You wipe that off, all the excess wax has dropped through the middle, so that's not an issue. It's going to go through the spout. So you just wipe the spout, wipe the hot plate, that can go through the washer disinfector. It's not going to cause any damage to anything. So don't forget this, wipe the hot plate when you're finished using it clinically.
Hi there, my name's Bryn Thompson and this is my lovely nurse Sheila. I've been a dentist for about 20 years and I've been lucky enough to be trialling these great products from Deo Dental, which basically all started from a water chamber for warming up impression compound, which I did a course with Mike Gregory about a year ago, and I've been getting back into compound, and this really has made it possible to do that. Beforehand I was messing around with different methods to try and allow us to efficiently use it, but it just wasn't working. So this is a brilliant product that has made, well, my life easier, hopefully your life easier.
Yeah, it's made a lot easier. It's just so clean and tidy. Yeah, and versatile. And
I think the key thing with a compound heater is that it keeps the water at a constant temperature, which is the problem I had before. So you want it at a constant temperature so you can do predictable impressions with it and not mess around and waste time. It's a really efficient way of doing it. So that's what we started with, and over the time we've got the different sort of modules that have made this a really fantastic multi-purpose sort of dental unit with a great sort of small footprint in your surgery. It means that you can slot the sort of components out. So this would be the water bath or the water chamber for heating the composite, but you can swap it in with these other components. For example, this is the green stick and sheet wax module, which is absolutely brilliant because it means that we can go to sort of flameless technique with prosthetics, so you don't need a Bunsen burner. sort of melting things and, you know, a flame going off and the patient being alarmed what on earth we're doing with that. You know, with the green stick syringes, this heater warms this up perfectly, so you can actually accurately sort of syringe the green stick onto your impression. This is just hot off the press now. This is absolutely superb, and probably the most exciting thing so far is the wax heater. So instead of putting a piece of sheet wax through a flame and it all drips everywhere and makes an absolute mess, which is what I was doing, I think.
Yeah, that is a real game changer, because like when he was doing it before, he used to whack it over the heat and wax used to go everywhere, and now it's just so compact and just tidy.
So it's really
good.
clever. You heat this up in the module, and then once that's to heat, you actually just take it out, open it up, put your sheet of wax in here, close it on. Don't put it back in the unit. You just pop it on the side for 15 seconds or so. You can see it nicely uniformly heating up, and then you literally just open it up, and then everything is a perfect uniform heat. So you haven't got one bit sort of dripping and too hot and the other bit not melted at all. It's just absolutely perfect. So I've just tried this today for the first time, and I can't wait to get back to the surgery next week and give this a go. So that's where it's sort of all started. But what's great about it is you've got these other components. So like normally with the mirrors, you'd be
under the sink,
under the hot water tap just to heat it up to stop the fogging. But then of course then you've got to wipe the mirror surface with a tissue or something else that's sort of abrasive to sort of dry it all off, and then that scratches the mirror. So with this, obviously it heats it up, and the unit's got different settings for these different modules for appropriate heating, and then the mirror's just at the perfect temperature. It doesn't fog up. You get your picture, and it keeps the mirror in a nice condition so that it's not all scratched up. So that's brilliant. And we used this for the first time last week, didn't we?
Yeah.
The wax heater for adjusting occlusal rims. Well, in the past I was using like a paint
You were
scraper.
using a scraper, heating it up and then putting it on top, weren't you? Now you just literally go woohoo, and it goes in the hole and
So the great thing,
inside.
from my point of view, when I'm using it, is the wax just literally floats off. It's unbelievable. Like just the feeling of it is incredible. But from Sheila's point of view, there's no mess at all, because it's cleverly got it's sort of angled so that the molten wax goes through the port here, and then it comes out into a silicone
cap in it.
Yeah, and then when we're done, then Sheila just sort of peels it all out, and then you dispose of that rather than have to scrape it all off the floor and what have you. So this has been fantastic. I've only used it this week, but this is already, I can see, going to be a big part of what we use.
Yeah.
Firm favourite. And then the composite one, well, we used primarily compules, which are basically held in the heater within the sort of compule gun. But if you're using syringe type composites, then there's ports for that, and then it just heats it up again to the ideal temperature that just allows that composite to flow much better. And there's local anaesthetic port as well, that you can warm up the anaesthetic to a nicer temperature. So it's just all very clever. You know, you've got the base unit, and then you basically, these store away really nicely, and then you just use what we use, really. So from my point of view, it's fantastic, and I think you found that it's
it's brilliant. We can put it all in the autoclave and everything, and it's just, there's no fiddly bits. It just goes really smooth all in together, interlocks nicely.
It just makes the treatment more efficient, and it just flows. So we're absolutely delighted with
all clean and tidy
with all the bits, and given that it's all come from the original unit, which is what really I was really most interested in, and it's amazing. To be honest, various like the mirror heaters, we would never have thought about doing it this way, but it just makes so much difference. So we've even got improvements on things we didn't know about. So one other thing that's really clever is with the compules, the ones that aren't in the gun, there's a very clever system on here that just holds the compules in position. So you can have multi compules in there, all warmed up, ready to go, especially if you're doing sort of layering techniques and you need different shades, or you need a different shade, in short time, then they're there ready rather than having to sort of warm them up and wait for that to happen. So that it's a really clever sort of storage system, and it's all heated at the same time. And another thing I really like about this whole product range is that it's completely made in the UK, and that's always something that's good to look out for when buying anything. That it's not all imported.
It's also very good in the fact that it doesn't get too hot. You don't burn yourself, and from a nurse's point of view, they're covered in this silicone rim, so again you don't get burnt. Your hands are always protected, and that's just such a lovely finishing touch to the product, I think. So yeah, really good.
So we've really enjoyed using this range, and we'll certainly continue to do so. And if you think you will, then please head to the website and find out more information there.
With the composite module, you can prepare it before the patient arrives. As you can see, you can load multiple compules and syringes depending on how many shades you require. When you're ready to use the composite, the syringes can be drawn out like such, and the gun can be easily removed from here. As you can see, the temperature has been set to 65 degrees for posterior composites and can be increased or decreased as you wish. So, for example, dropping it down to 55 degrees for anterior composites. When you're ready, you remove the gun, and you can apply the composite into the cavity. The composite flows out beautifully and is ready for you to pack. If you're interested in this module, then please visit our website. With the composite module, you can prepare this before the patient arrives in the chair. As you can see, you can preload it with syringes and compules. When you're prepared to use the composite, all you need to do is draw the gun out or draw your syringe out. It has been set at 65 degrees for posterior composites, and you can reduce the temperature for anterior composites. As you can see, it flows out beautifully and now can be packed really well within a cavity. Everything here in this unit is fully autoclavable, so it can be sterilized between patients. If you wish to purchase the composite module, then please visit our website. For the purpose of filming, I'm not wearing a mask. One of the great things about the unit is that placing your mirrors in here means that they become heated and you don't get any fogging while taking intraoral photography. Thank you. Crystal clear image, and as you can see, no fogging in the mirror at all. If you're interested in purchasing the unit, please visit our website.
Hi, my name is Mike Gregory. As you probably know, we've been developing these products. Deo Dental have come up with these genius products, and we've now established a range of products which we can use for treating patients, teaching undergraduates and postgraduates. I work with Mustab at a teaching establishment, and he's kindly come along today to tell us his view of what he thinks about the way these products work and how useful they can be for teaching. So I think we start with we introduced Musab to the water chamber some time ago, and we gave this to you how many months ago?
I think it's coming up to almost a year now, I feel. Yeah.
And you found it?
I mean, because I use it in practice very, very regularly. And as of just about yesterday, I used it as well on one of the patients. And especially in our kind of work, we get a lot of prosthetic patients. So using it for them to take impressions, I think has made life a lot simpler, because going on from previously when I studied and coming on to the clinics and things, there was always a cross-infection issue. How do we clean it, things like that. But this has solved a lot of those issues, and especially in an age where we don't want things that we throw. We just want things that we can sterilize, we can reuse. I think it has really changed the way I work.
How do your staff find using this in practice? Any resistance? Any sort of worries about they?
Oh, so I think for the first few times that they used it, they were pretty excited about it, that it was a new product to use. And I think because they can just put it in an autoclave very quickly, I think it makes their lives a lot simpler. Because what previously used to happen was I'm talking about only practice now, alternate bowl, getting a kettle on, putting the hot water in, and getting it to a point where it's reasonable, but we never knew what the temperature was.
Yeah.
And it was always like, okay, is the compound or is too hot? Am I going to burn the patient? So I was always checking the compound before putting in the patient.
And it sticks to your gloves if it's too hot. Compound, a horrible mess.
And it sticks to your gloves as well. So I think that has made, because we don't have to get the kettle in, and that kettle used to be from the kitchen. So there's always that, okay, do I want to be bringing this into my clinic? I never wanted to do that. So, I just put water in, leave it on. It makes my life a lot simpler.
Great, isn't it? Really good. Yeah, magic.
Yeah.
And now we've come up with this gadget, which I think you're really impressed with, aren't you?
Yeah, absolutely.
The hot plate.
I think because what we are using in practices and teaching establishments is the fact that we have these paint scrapers that we put the wax rim on and we melt it. And that's the bit that because we are adjusting it, it's always, we don't have finer control. In a teaching establishment back in the day, we had those old bits where we had to, we had that, but we couldn't find anything. We searched online quite a lot, but we couldn't find anything. So this has changed a lot, because I'm not now holding a paint scraper in my hand and trying to see how wax rims can be adjusted.
The flame roaring away, which practice managers always hate, don't they?
Yeah, absolutely.
And if you're teaching undergraduates with naked flames, slightly frightening.
I think naked flames, hands down, should ideally not be used at all in practice setting or teaching establishments for that matter. They are a hazard. So if we can wear this, I think the whole point of this is getting away from flames and things, and just making sure everything is done without that.
And talking of that, this is something you've not seen until today.
Yeah.
This is something you've not seen, I only saw today, and this is just a revelation. So this component here will heat up these things, and they retain the heat amazing. It's like a heat sink. You put a piece of wax in there, you close it down, you put it on the bench top, and in less than 10 seconds, that's as pliable as a piece of wax.
Wow.
Just unbelievably easy to use. And there's two of these, so again, no naked flames. It's student-proof. You put it in there, heat it up. There's two of these, you can take the next one out, put the wax in, 10 seconds, and you can use it.
Yeah.
So, I don't know what you think, but something like that for undergraduates, just magic.
I think we talk about students here, but I think if we look at where, a lot of people who are coming out who've perhaps not done prosthetics in a while, this is quite important, because this takes you to the bare basics of things that, these are the basic things that we can always use. It's not something that needs skill, that you don't have to be a specialist or a postgrad to be using this. Simple things that you can use in practice, absolutely. And that makes a huge difference. The other thing that I've used, and we always talk about compound and things. The one thing when you're relining dentures, I put my denture in there. And because with the exothermic reaction, you want it to heat, you want it to set, and it sets pretty quickly. So I just use that as well. I think it's the more, because you have it, the more you have the opportunity to use it for different things. And that's the main thing, really.
The other thing that's come to my realisation recently is that this is analog dentistry. So if you want to use compound, you want to use green stick, you want to use wax, it's cheap to actually treat patients.
Yeah.
Whereas if you're taught with a scanner and you can't use analog dentistry, if you end up in the wrong place you work in, and you haven't got a scanner, you're stuck. Whether you've got this kit like this, a minimal outlay, really cheap consumable materials, costs next to nothing by comparison.
Absolutely. I mean, digital dentistry, is moving forward. Even with the denture side of things, we are moving forward. But I think there's still a gap in the technology side of things. I mean, and even with the people who are doing digital dentures, they have to do some kind of impressions and some kind of modifications at the very end. And, again, these materials will be...
Of course, if your scanner packs up,
your
scanner packs up, dentistry can't stop.
Yeah.
So if you've got something like this, it works.
Yeah.
So, and again, I think you've seen the concept of this, heating up green stick.
Yeah.
No
Absolutely.
naked flames.
Yeah.
Just inject it onto the tray, temper it in a water bath, and off you go. So, that again, that's reducing the risk to anybody. No naked flames. And the thing with this is, it's the right temperature when it goes in the mouth. You haven't got to worry too much about it getting too hot, which is undergraduates definitely guilty of actually putting the mouth too hot, or conversely, they let it cool down too much, and then
it's not malleable.
then it doesn't work. So
yeah.
And then we got the mirror heater, which you do loads. I know you do loads of photography. How do you mirror heating?
At the moment, because I had not seen that, what I was doing is I was just putting it in there, without any water, without anything. Now, initially, what my nurse was doing is just filling this up with water and putting that in, because that would heat the mirror up, and then she would just wipe it and use it. But then one day we just left it without any water or anything, and it still worked. And that's the thing, because when you're taking photos, and I take photos of each and every step for teaching purposes, for recording each and every stage, and and that makes the biggest difference. That I don't have to go like, okay, she has to put in hot water, wait for it, and then clean it, and then come and bring it back to me. It just is simple. And that's a bit simplifying the procedure.
Because the other thing with cleaning the mirrors, you're dangerous scratching them.
Yeah.
Because the surfaces abrade really easily, don't they? And then your mirrors are in the bin, and you got some more mirrors.
Yeah.
So this makes your mirrors last longer as well. So you can't really go wrong, can you?
No, absolutely.
And I think you've been a fan of the concept of this, haven't you?
Yeah,
heated composite.
Because a lot of cementation, especially with the revolutionizing of, we barely do crowns anymore. Even when we're doing crowns, we're doing minimal preparations, and we're doing more onlays, that sort of things. And most of my onlays are cemented with heated composites. So getting the temperature, so what I had bought, I know there are a lot of companies out there which sell something where you can heat composite. I bought something of Amazon, which was 20 quid just to heat the composite. Did work, but the problem was, the temperature. What it's saying on it, is it the right temperature or not?
I did some experiments at home. So it's just miles off, isn't it?
Yeah, I mean, and that's the bit, right? So I'm like, is it the right temperature? So I was a bit guessing on that. And I think this is what changes it, because it does give you an idea of the temperature that it's at. And we have studies to prove, okay, this is the temperature the composite should be heated at. So that there's more predictability with regards to that. Now, I mean, I know here I'm talking about clinical and teaching side of things, but the other bit that people would not talk about is the research avenues from this, because when we do research side of things, we want everything constant, and we just
that's a good point.
We just change one aspect. If the temperature is constant, there are a lot of avenues for research that has not been tapped into. And
the units available on the market, I think even more expensive ones, I wouldn't necessarily trust. Temperature-wise for stability, whereas this is just always there.
And that's a bit, the predictability of especially the temperature, just making sure. And this is, not only composite, it allows you a lot more, doesn't it? I mean, this is the gun bed, but there are ampules on the inside.
So underneath you've got the option to put a local anaesthetic in.
Yeah.
You put compules, you can put endo materials in there.
Yeah.
So irrigants and the like as well. And again, as we said before, the whole thing, cross-infection is not an issue, because all of this can go through a washer disinfector and an autoclave.
Yeah.
So you're compliant wherever you are in the world. It's just compliant with any regulations that might exist.
And I think the other advantage is I don't need to get 5 of these. And that was when we were initially looking at it, like, do I need like 4 of these do I need separate one for this, separate one for that, separate one for this? Yeah. And I think that's what would have been cumbersome. It's like I have to buy 5 different kits, which is not the case really.
And now we've actually organised this. Deo Dental is actually, we now got a programme on the side. So you press one of 4 programmes, and it just selects the programme for the material you're going to use, and then you can moderate the temperature. If you want to, as again you said about experiments, if you want to do research, you can actually jack the temperatures up and down once you've got the unit, and actually test at different temperatures, and it's predictable. So It's great. Good product.